So myofascial release techniques for the lumbar spine region. Here we would use techniques to try and actually release any adherence in the soft tissues in the lumbar spine region. Commonly we find adherence in the fascia surrounding the erector spinae muscle because of overactivity in this muscle in particular. If we felt fascial adherence in this area, we could use direct techniques to the fascia, such as skin rolling, where we're actually trying to pull the skin and the fascia away from the muscle. So we can work through the lumbar region, really trying to pull the skin and the fascia and stretch it away from the muscle underneath. Another direct technique we can do to erector spinae would be getting in with reinforced thumbs where you felt restriction, which commonly would be very much where erector spinae comes and attaches onto the spine. So just off the transverse processes, sinking into where you feel the resistance in that region with a nice slow, direct stretch through that tissue. You could do an indirect myofascial release to the erector spinae and the thoracolumbar fascia passively using a stretch with opposing hands. So using your flat hand, you could bring up some torsion into the fascia with quite a light resistance until you felt the stretch in the fascial superficial tissue, and then hold that nice sustained stretch and then slowly just pull your hands apart. Moving out onto lat dorsi, we could also do an indirect myofascial release, but using active movement of the patient. For this, if we felt where the actual fascial restriction was along the lat dorsi muscle, we could hold and put a stretch on that superficial fascia with a flat hand, and once we'd held that resistance, we'd get the patient to try and move the muscle underneath actively by just flexing and adducting their arm up and down. This would indirectly mobilize the myofascial tissue by trying to free the muscle from the restricting fascia. We would continue that until we felt that the fascia wasn't trying to pull when the muscle was moving.